I'm going to talk to you today about the anti-stroke vitamin as backed up by science. So the vitamin P factor, which is a part of the vitamin C complex, is the anti-stroke vitamin. Now this was said by Dr. Lee, who created standard process in 1947, and they pretty much laughed him to scorn. There was another guy before that. His name was Zvent, a doctor named Zvent, medical doctor, and he did a lot of studies on that. He was from Hungary. And so they knew it back then, but in 2012, a Harvard study came out saying, yeah, the rutin or the P factor is the anti-stroke, anti-clotting vitamin. So they looked at 5,000 compounds, and the one that was the best was vitamin P, the P factor. So their statement that they said was this in that article, when I read that article: if scientists tried to design a clot-preventing molecule, they could scarcely have created one more perfect than rutin or the P factor. Those two terms are the same. So you can get this rutin out of other things like onions, tea, different flowers have it, but the best source, they said, was the buckwheat plant by far. And so the buckwheat plant, when they process that into a supplement, and this is a supplement, Cyruta Plus. Now, when you're talking about things like easy bruising, that would be a sign you need this. Gums bleeding, vaginal bleeding. Vaginal bleeding, we have to use a couple other things for. But in every case we've done this, it's gone away. And so the buckwheat plant, if they take the seed and they make a supplement, that's going to be something that dissolves plaque in the arterial system. But if they take the plant, that's what has more P factor, and this supplement, Cyruta Plus. So the seed is different than the plant. So most people don't realize that, but the part that you take it from the plant gives you different effects. Now, ascorbic acid, I just pulled my chart since I don't have my whiteboard today, and ascorbic acid is just the eggshell of the vitamin C complex. Here's the rest of the vitamin C complex. So when they do a vitamin C and you pick it up in the store, it says ascorbic acid, all it is made in a laboratory. So they also did a study comparing those two. The ascorbic acid that they made in a laboratory had no effect on healing capillaries, whereas the rutin, the vitamin P, did have a fantastic effect. So this was way back, and that's when they said, okay, it's not a synthetic that's going to heal, it's from food. It's always got to be from food. So any type of bleeding issues. Now, we also use this on any gut problems, because most gut problems is Crohn's disease, if it's ulcerative colitis, whatever it is, need that type of support to the vascular. The gut has a highly extensive vascular complex there. So you need to do that to help that. So you're never treating the disease with nutrition. You're just giving the body what it needs. The body treats itself. You just got to get the right nutrition. And so, of course, in gut problems, we use more supplements to that, but we always use the P factor. So this is it. Again, Cyruta Plus. If you have any questions, you can call the office, 314-843-9355, whether you're a patient or not. And also, if you want to get Cyruta Plus, and just take it as an anti-stroke vitamin, not to be treated or anything with it, that you need to call the office. But if you just say, I want to take the anti-stroke vitamin, my wife takes it, I take it. I mean, I take it every day. I just took 6 pills, right? So I could get it in. No, I didn't. I took 3 pills. And so I want to decrease the chance of stroke. And of course, there's no guarantees. It doesn't eliminate the chance of stroke. But we want to do everything we can do nutritionally in order to decrease that chance. You can also call us. We can ship it to you. And you can also go on my webpage, shopnutritionclinic.com. Third button down on the left, standard process, whole food nutrients, I think it says. Click on it, and you can have shipped right to your home. Take the proper nutrients, and you will be a healthier individual.